Hello, my name is Brenna Shatswell. Today we'll be presenting this in-service on multidisciplinary holistic care of the adult patient with congestive heart failure. I hope that this information is useful for incorporating the best care of our patients diagnosed with congestive heart failure. After completing this in-service, the interdisciplinary healthcare team will identify the population at risk for developing congestive heart failure, or CHF, and identify patients at risk for complications or rehospitalization from CHF. Recognize health promotion and risk reduction goals of care and interventions utilizing national standards of care. Recognize typical symptoms, assessment findings, and typical diagnostic and lab tests in CHF. Assist the patient in reducing symptoms of CHF, reaching their highest level of health and wellness by utilizing holistic approaches and improving the quality of life and well-being for patients with CHF. Congestive heart failure, or CHF, is a common chronic illness made up of a collection of symptoms in which the heart isn't pumping enough blood to meet the body's needs. 5.1 million people in the United States are diagnosed with CHF. 1 in 9 deaths are attributed to CHF. CHF has a high morbidity and mortality rate, as half of people diagnosed will die within 5 years. The health care cost of CHF alone in the U.S. is over $32 billion annually related to health care services, medications, and missed days of work. CHF increases with age, and it's the leading cause of hospitalization in people over 65. CHF is more common in men than women. A person's lifestyle can contribute to CHF, including obesity, poor diet, lack of physical exercise, and smoking. One way to prevent CHF is to control conditions that cause CHF, such as coronary artery disease, hypertension, diabetes, and renal disease. A history of acute myocardial infarction increases CHF risk, secondary to reduced contractibility of the cardiac muscle. Other contributions include valvular disease, cardiomyopathy, and a family history of heart disease. The Institute for Healthcare Improvement has initiated a 5 Million Lives campaign, including a how-to guide for improving care of patients with CHF. The 7 key components are supported by the Joint Commission and the American College of Cardiologists. These include left ventricular systemic heart function assessment, ACE inhibitor or ARB prescribed at discharge for patients with systolic dysfunction, anticoagulant used for patients with atrial fibrillation, and beta blockers prescribed for left ventricular systolic dysfunction. Also, it's imperative to offer seasonal influenza and pneumococcal vaccinations, smoking cessation counseling, discharge instructions that address activity level, dietary changes, medication teaching, follow-up appointments, daily weight monitoring, and discuss what to do when symptoms worsen. The symptoms related to CHF exacerbation are distressful for the patient and reduces quality of life. Controlling symptoms will reduce further complications and reduce rehospitalization rates. Reduced hospitalization lowers healthcare costs and improves quality of life for patients with CHF. Nothing improves self-care of the patient with CHF more than education. Assessing a patient's health literacy and planning teaching accordingly using a teach-back method is most effective. Providing a log to monitor daily weights and enhance written instructions on recognizing symptoms of CHF and modifying diet and fluid intake and medication instructions is important to ensure patient compliance with a plan of care. Care coordination incorporates the patient and their family into planning care, provides lateral integration of services to reduce fragmented care, and streamlines the post-discharge process. It is imperative that the patients follow up with their primary care provider soon after discharge. Home health follow-up by a nurse goes a long way in encouraging compliance with the plan. Many hospitals and/or clinics have found success in reducing rehospitalization and complications related to CHF by integrating a telehealth home telemonitoring program after discharge from the hospital. This technology enables closer monitoring. Thus, the clinical team can take steps to prevent complications before they occur. Many studies have shown the greatest benefit comes from reducing modifiable risk factors by adhering to a healthy, balanced, and low-fat diet, also low-sodium diet, regular exercise, weight loss, limiting alcohol use, and smoking cessation. The interdisciplinary team can encourage the patient with CHF to adapt to a healthier lifestyle and praise positive changes as they occur. CHF is a pathophysiological condition in which the heart is unable to generate an adequate cardiac output such that there is inadequate perfusion of the tissues, increased diastolic filling pressures of the left ventricle, or both, which causes pulmonary capillary pressures to increase. Cardiac output and stroke volume is reduced secondary to reduced contractibility, which is usually caused by a myocardial infarction. Ventricular remodeling results in hypertrophy and dilation of the myocardium and causes progressive myocyte contractile dysfunction over time. Ventricular remodeling is mediated through inflammatory, immune, and neurohumoral changes in the body. As cardiac contractibility becomes more impaired due to ventricular remodeling, the ventricle is more likely to dilate and fail, reducing pumping capacity and tissue perfusion in the body. As cardiac output falls, renal perfusion diminishes with activation of the RAS, or the renin-angiotensin-aldosterone system. This system in our body releases hormones which causes further sodium and water retention and vasoconstriction of the vessels. This vicious cycle of decreasing contractility increases preload, afterload, and causes progressive worsening of the left heart failure. Management of systemic heart failure is aimed at interrupting this worsening cycle, as well as blocking the neurohumoral mediators of myocardial toxicity. The clinical manifestations of CHF are the results of pulmonary vascular congestion and inadequate perfusion of the systemic circulation. Typically, a patient with CHF will present with shortness of breath, which increases with activity or when lying flat. This occurs because blood backs up into the body that is returning from the lungs to the heart due to ineffective pumping. This causes fluid to leak into the lungs, causing congestion. Ineffective pumping also causes fluid to build up in the body, leading to increased edema and weight gain. Hepatic congestion causes symptoms such as bloating, indigestion, and poor appetite. As the body diverts blood to major organs as a compensation mechanism, blood is shunted away from extremities, leading to a feeling of weakness. Dizziness and/or tiredness are a direct result of poor blood flow. The kidneys receive inadequate perfusion as well, reducing urine output. Nocturia occurs when the extra fluid is redistributed when the patient lies down. The heart is having to work harder, the heart rate increases, and the patient may complain of palpitations. The overuse of the cardiac muscle in an attempt to adequately perfuse the body may lead to feelings of chest pain. CHF is progressive and symptoms become worse with time. Physical examination often reveals pulmonary edema. Signs and symptoms include cyanosis, inspirating crackles, and pleural effusion. Wheezing may also be heard in the lungs. An S3 gallop or alternating strong and weak beat may be heard upon auscultation of heart sounds. Edema may be prominent mainly in the legs and feet, but also may be noticed in the arms and abdomen. Increased central venous pressure may lead to jugular vein distension in the neck. Increased fluid in the lungs reduces oxygen saturation and increases oxygen demand. The patient may become more shortness of breath with ambulation or with any activity. Diagnostic tests may reveal other manifestations such as underlying coronary artery disease, hypertension, or cardiomegaly. Many different diagnostic tests and lab work can be used to diagnose and assess the severity of CHF. A chest X-ray can detect cardiomegaly, lung disease, or the presence of fluid in the lungs. An electrocardiogram assesses the heart's rhythm and rate. An echocardiogram measures the pumping capacity of the heart and measures the ejection fraction, or EF. The EF should be above 65% in a normal adult. Below 25% indicates reduced pumping capacity. A B&P blood test is the cardinal lab test which is used to detect the presence of CHF. B&P stands for brain natriuretic peptide, which is a hormone released in the body with heart failure. The B&P will lower as the treatment for CHF starts to work. A Holter monitor measures cardiac activity over a 24 to 48 hour period. A stress test measures cardiac function with increased activity. A coronary angiography can detect where the damage in the heart is, and a cardiac catheterization checks the pressures and blood flow in the heart chambers. Any chronic illness can lead to stress and depression due to functional decline, increased healthcare costs, and changes in work and relationship status. Depression is an independent risk factor for hospital readmission in patients with CHF. Many non-pharmacological interventions are available to help alleviate the stress and anxiety and may relieve some bothersome symptoms associated with CHF. Mindfulness-based approaches include meditation and hypnotism. Some benefits of meditation include relieving stress, improved brain functioning, relief from insomnia, improved immunity function, and increased relaxation. Some physiological benefits of meditation include increased energy, lower blood pressure, decreased pain, and improved mood. Deep diaphragmatic breathing encourages full oxygen exchange, lowers the heart rate and blood pressure, and these can be done anywhere, and they're easy to teach patients. Yoga has many benefits, including lowering stress, reducing depression, and increasing physical fitness. One recent study of CHF patients who participated in yoga classes twice weekly for 8 weeks showed a significant reduction in weight, improvement in the severity of depression, and improved quality of life. Beneficial dietary changes include lowering sodium, fat, and limiting excess fluids. Following these guidelines can reduce retained fluid in the body, along with elevating legs above the heart. Some beneficial therapies include massage, Reiki, or Tai Chi. Pharmacological interventions are beneficial as well in reducing symptoms of CHF. Some dietary supplements have been shown to help patients with CHF, including hawthorn and CoQ10. Diuretics reduce preload and reduce fluid buildup in the lungs and body. ACE inhibitors lower blood pressure, reduce strain on the heart, and reduces the risk for myocardial infarction. Aldosterone antagonists trigger the body to release excessive sodium and water through urination to relieve symptoms. Beta blockers decrease the workload on the heart by lowering blood pressure, and angiotensin receptor blockers, they relax blood vessels, lower blood pressure, and reduce workload on the heart. The highest standards of care for CHF include utilizing an interdisciplinary team and may include the following people. The primary care provider provides routine preventative health care. In most cases, he or she remains in charge of overall care and is the main contact for questions or advice. A cardiologist treats cardiac problems. A physical and occupational therapist assists with cardiac rehabilitation and helps to develop a physical activity plan. A dietitian teaches heart-healthy eating guidelines and helps organize meal plans. A mental health professional helps deal with emotional stress, anxiety, and depression. A social worker or case manager helps with complex financial, legal, or other issues, including finding social support services. A pharmacist is an excellent resource for medication information, interactions, and education. In conclusion, congestive heart failure treatments have come a long way, but there is still lots of improvements that need to be made. Through research, national standards of care include a multidisciplinary, patient-centered, holistic approach to treatments, including access to quality care, education and follow-up care to manage symptoms, care coordination, medication management, reducing psychosocial burdens of depression and anxiety, and offering a palliative approach if the burdens of treatment are too much. Holistic care also includes incorporating social and spiritual aspects into the plan of care. When the multidisciplinary team adopts these concepts into caring for the patient with CHF, they are able to reach their highest level of health and well-being. Thank you for listening to my presentation today.